When we hear about pneumonia, many of us often think of it as a serious disease, especially for the elderly or anyone with health complications. But for a child who doesn't have basic medical care like vaccines, pneumonia can be deadly. Joining me now to talk about what's being done is Dr. Namala Makopi, a pediatrician in Tanzania, along with Elizabeth Adelaide, a volunteer for the UN's Shot at Life campaign that raises funds for vaccines. Welcome to you both.
Thank you.
Dr. Makopi, let's start with you. Explain to us, why is pneumonia so deadly for children in developing countries?
Well, pneumonia is so deadly for children in the developing countries simply because children less than 5 years of age, usually their immunity is very low, and they are very much vulnerable from getting these infectious diseases. So when they get infectious diseases such as pneumonia, it usually has bad outcome, and most of these children usually die. And in 1 out of every 5 children living in the developing country do not get access to these vaccines that can prevent these infections. And what we're doing at the moment is trying to advocate for people involved in this global initiative and activities to make sure that that one child is reached with these vaccines.
Doctor, you played a big role in getting the pneumonia vaccine to Tanzania. Can you tell us about that?
Well, it's a multiple facet initiative, and everybody on board is trying to be involved. And personally, as a child health activist and a pediatrician who is seeing a number of children dying every day because of these vaccine preventable diseases, I played my part by making sure that I talked to important stakeholders and decision makers to make sure that the vaccine is included in the immunization schedule for my country. And 2 years ago, the vaccine was included in our immunization program, and now we have children vaccinated for this vaccine for this killer disease in our country. And we have seen the trend of diseases now. Children who are dying from this disease have been decreasing.
Elizabeth, I'd like to talk with you next. Tell us about the campaign that you're involved with the UN. What's the mission?
So I'm a volunteer with the United Nations Foundation Shot at Life campaign, and I advocate for global health vaccines, and we raise awareness and funds to help get access to children in developing countries life-saving vaccines.
I'm guessing the situation must be pretty bad. That's why you got involved?
Well, knowing that nearly 1 million children died last year from pneumonia itself because of lack of vaccines, 1 in 5 children don't have access to these vaccines. Yes, I, as a mother, feel compelled to advocate for children all over the world because every child deserves a shot at a healthy life.
Okay, so what can we do as Americans to help get these vaccines where they're needed?
We can reach out to our government representatives and ask our congressmen to support funding for global vaccines. Global health is one of the best investments that we can invest in for the world and for our future. And every child deserves access to these life-saving vaccines. I can't imagine losing a child to a vaccine-preventable disease, and I don't think any mother should have to go through that anywhere in the world. So if we reach out and let our government administrators know that we want support for global vaccines.
Great, and a lot of people right now are wondering how they can get involved. Is there a place we can go for more information?
.org. You can find tools for advocacy, and you can donate there and learn more about shotatlife.org.
Wonderful. Thank you both for being with us and all the great information.